It began as a journey to self-discovery, but it's a quest that hasn't quite come to an end. An international leader on race and genetics and health disparities, Rick Kittles, would likely say that's a good thing. And so would the more than 150,000 people that have utilized the company he co-founded, African Ancestry, to help connect the DNA dots to their family tree. But the discoveries don't stop there. The RIT alum and director of the Division of Population Genetics at the University of Arizona is in Rochester. He's the keynote for the 2017 Patients First Awards Luncheon for Jordan Health Foundation. Before that keynote, Rick Kittles joins us in the studio to talk genetics, ancestry, and how it all connects to health. And Rick Kittles, welcome. It is an honor to have you here.
Thank you.
So I understand, and you can correct me if I'm wrong here, that you had an interest at a very young age in biology and math, and you used to look around your classroom and you would look at the different shades of skin color and the different hair textures, and you would wonder, why, how does something like this happen? So talk to me a little bit about how that curiosity ultimately led you to becoming this world-renowned geneticist. And I understand it's a personal story connected to that.
Yeah, I just was always interested in variation and diversity. And I would look around rooms and just look in awe and appreciation of just how different folks looked. And I knew that there had to be some genetic component. You know, we inherit these traits from our parents, where we resemble them in some ways, and we're a mixture of their genetics. And so it always, you know, looking at skin color, body height, body weight, but then also eye color and hair texture, stuff like that. I always was excited about trying to decipher how genetics played a role in the biological diversity of man. And so I would, you know, read a lot about it. And then in school, I took courses that would help me understand it better. And I knew that when you look at, for instance, African Americans, it was such a large set of diversity there in terms of how African Americans look. And we come in all types, right? And so I said, well, Africa must be the root of a lot of this genetic variation. And in fact, it is for humankind. In fact, modern humans started in Africa, and that's where the root of all of us in terms of our genetics arises from.
I want to point this out. You co-founded in 2003 African Ancestry. It has been described as an international leader in helping trace maternal and paternal lineages of African descent. So the database that you have, you've collected over 30,000 indigenous African samples that you began to collect quite some time ago. So talk to me a little bit about what makes African Ancestry so different from others that exist, such as Ancestry.com.
So I started my career as a genetic epidemiologist when I was at Howard University back in '99, 2000. And one of the things that I noticed as I was trying to understand genetics of cancer in African Americans, in particular prostate cancer, I noticed that our databases and our understanding of genetic variation in African descent people was very limited. And so I wanted to know more about it, to try to, you know, collect more data to really understand the context in which we are. You know, we place our genetics into a particular context, a body of variation. And so I said, well, I need to really start collecting data. And I worked with anthropologists and geneticists and historians to try to collect data that was important for the history of African Americans. And a lot of that is centered around West Africa, of course, and the transatlantic slave trade. And so being at Howard University was important because it was one of the biggest medical schools for training doctors from Africa. I mean, you know, students who wanted to become physicians. And so there was a lot of folks from Cameroon and Nigeria, Senegal, who came to get degrees. And so I worked with a lot of them. I sent students to Africa, and I went there myself, and I worked with a lot of historians and archaeologists also. And so we were able to amass this very comprehensive database that allows us to look at African American genetics in the context of present-day African people.
Well, in an interview that you did a few years ago, you said there's now this intersection between science and society, and you said it's caused some conflict to a certain degree, but it's also helped us to reconcile some of the uncomfortable histories from various ethnic groups. So talk to me a little bit about why, what are some of the opposing views, what are the arguments that you hear in relation to this?
Well, you know, this country was founded on race and racism and segregation, and so we have this history, this really sad component of American history that is uncomfortable for a lot of people to try to deal with. And in fact, that's why I firmly believe that it's going to take a long time before we're able to really let go of this issue of race in the United States. And so when we try to understand sort of family history and ancestry and place it in the context of race, race really isn't a biological concept. It is more of a social political construct. And so when we overlay genetics and social political race and ancestry, it does create some tensions. For instance, we think about African Americans. We think that all African Americans have a lot of African ancestry. That's not necessarily the case. You know, based on family history, you may have significant European ancestry or Native American ancestry, but still call yourself African American. And so we have to really understand that the genetics and the science and the technology is actually creating ways and opportunities for us to create new identities and new terminologies of how we define ourselves. One of the issues, I think, you know, folks say, oh, well, you're really using this to reify race. No, we're not reifying. And actually, we're deconstructing race. We're saying, look, race is not this genetic entity for humans. In fact, what we're doing is showing that we are all part of this human family in some way, one way or the other.
Well, your varied roles and areas of expertise, immense, by the way, encompasses race, genetic ancestry, cancer genetics, and also health disparities. And the thing that I think is so fascinating is this intersection or this cross between genetics and ancestry and health. Explain how that works.
Well, you know, we inherit our DNA from our parents. And some of these genetic variations that we inherit actually lead us susceptible or higher risk for particular diseases like cancer. But we also, you know, we don't just inherit genetics, we inherit certain behaviors like diet. So, you know, there's like these old Ghanaian proverbs that the one pot in the family that everybody eats from or whatever, that's a major sort of component in terms of the transition or the transmission of diet. And so diet and lifestyle also is important. So we inherit these things. And so there is what we call a genetic history, there's a disease history and behavioral history, all intertwined to create your risk profile for disease. And so now we're at a point where we can really look at the genes that we inherit and how some of the variation in those genes impact risk for disease. So we're doing that in the context of diet, lifestyle, in really interesting and sophisticated ways now. So this is an exciting time.
So talk to me a little bit about how is that beneficial for those that are dealing with populations dealing with health disparities? Right.
Well, health disparities in particular are, you know, for the most part, social determined, meaning behavior, diet, lifestyle, opportunity, access to health care, compliance with your physician, stuff like that. But then there are some of these diseases that have a strong genetic component. For instance, prostate cancer is one of them. Triple negative breast cancer, where there's this strong genetic family history that's contributing to that disparity. But the bulk of disparities, type 2 diabetes, hypertension, really are more so socially determined and in fact can be, you know, we could create interventions that are more social that would have an impact than just studying the genetics of it. You see what I'm saying? So it's not just an easy sort of answer when we talk about disparities. But one of the things we are looking at is how do we assess someone's baseline risk based on their genetics and family history. And for instance, if your risk is higher for prostate cancer and you're 25, 30 years old, you and your doctor should know that you should be screened more regularly once you get, you know, in your 40s, 45 years old, because you're at an increased risk. So those things could be quite useful for not just physicians, but the patient too, to understand that I have this increased risk now. I need to be screened more aggressively. I need to stay on top of this before it gets too late.
Before we close, I have to say, I understand that a number of celebrities have participated in seeking their roots, and you serve as a DNA expert for Henry Louis Gates' PBS program, assisting in that effort. Can you tell me any interesting celebrity DNA, stories or findings, or how someone may have reacted that to you is just meant something to you?
Well, they vary. I mean, just like the average person on the street, we have so many different narratives. We have so many different stories, and so. I'm excited when I was quite excited, for instance, when Isaiah Washington received his test result. He was, I don't know if you've seen it was on I think it was Good Morning America or something, where
he go to YouTube and get that video
right, where he got so excited.
Yeah.
And when he found out he had ancestry from Sierra Leone. But one of the things that I really liked and appreciated was beyond just that level of excitement, he actually went back to Sierra Leone, was able to get dual citizenship, was able to build and help them with building hospitals and homes. And so it was one of those situations where he became an advocate because of that connection that he had with DNA. And that's what I really wanted to see as we started this process.
Well, unfortunately, we have to close for now, but to Rick Kittles, thank you so much for your time. And the good news for you is you can hear more from Rick Kittles. He'll be speaking at the 2017 Patients First Awards Luncheon for the Jordan Health Foundation. That is this Friday, September 15th at 12 p.m. at the Rochester Riverside Convention Center. So get your tickets at jordanhealthfoundation.org, and also be sure to learn more about African ancestry online. Just go to africanancestry.com.